I'm going to now demonstrate as if this is a live patient and we'll do a complete restoration. So I'm going to add a new patient. I've done this before. So I'm just going to type in a last name and a first name. And then I always skip the date of birth. You can see again we've got the red on the bottom, so patient ID. I give a patient ID and dentist will be Fox. So now we've got the green. I'm going to add a new case. I'm doing a single restoration. I'm doing a crown. I'm doing biogeneric individual. I'm doing Emax CAD, and I'm using my milling chamber, and I'm choosing tooth number 30. Okay, again, case details show up in case I want to make any changes. I'm going to go next to acquisition. It asks for the lower jaw first, so I'll remove the camera. I like to lift my foot as I approach, drop it, and then once it starts taking pictures, I look at both the screen and back and forth into the mouth. Once I'm happy that I've gotten all the pictures, I'll stop the camera, blow up, and check to make sure that I have all the interproximals and I have all the margins. And you say I've got a little tiny bit of a defect right here. I want to go pick that up because it's right under the margin. And if I leave it, what may happen is the automatic margin finder may not find it. So I'll lift my foot, go back, and then I know it was right in that area. So I'll just pick that up. Hang the camera back up. Remember to always hang your camera up when you're not using it. I'm going to now go to the upper jaw. Lift my foot, then drop it. And once it starts taking pictures, and I kind of wave back and forth a little bit and just helps bring the pictures into focus. Always end on the occlusal. And then I'm going to do the buccal next. And again, when I do the buccal, I like to start in the back. Tell the patient, stay biting please. Don't open. Stay biting. Medium pressure. Stay biting. And I just wander back and forth. Make sure that I don't go any further than what I did with my upper and lower jaw. Then we'll go forward. And it's going to make the upper model, lower model, and the bite registration. Once the three models are calculated, we'll wait until it automatically places everything together. Once it's placed, now remember, for some reason this did not open, so I want to go over to Model Contacts, that's under Analyzing Tools. Left click on Model Contacts, and I'm going to double check in the mouth, make sure that this is my patient's occlusion. Once I'm happy with it, I'll go next to Set Model Axis. Right click and hold, drag it down onto the face bow as we've discussed. Left click and set the curve of Spee and Wilson. Right click and drag it down just to get the occlusal plane correct. Once I have the model axis, see it's red, I'm going to hit OK. And then I'm going to go to the next. I personally, like I've talked about in the past, like to trim area. So I'm going to trim the area. I'm going to blow the model up, left click and roll. That's left click and hold. Double left click. Once I get in between the interproximals, double left click again, and that'll cut that side off. Right click and hold, drag it to the other side, double left click to start and double left click to end, and I'm going to double left click on the restoration. Now I'm going to draw the margin. And again, as we've discussed, start slightly inside, start with a double click, and then keep your cursor inside and go as far as it can go. And this is why you want to cut very good preps. End with a double click. Evaluate to make sure that it's on the margin. And if the margin is very crisp, you took good pictures, that's how you should be able to draw these. We're going to define the insertion axis. Now again, this is not the same as the path of insertion. This is the insertion axis, how it's going to mill. So we want to make sure that we can see directly down and that we don't have any yellow, which would create undercuts. So we're going to look, set it. I'm going to hit OK. Preparation analysis, I can look at that if I wish. Now again, the problem I have is that it's showing me right now that it's in this 2 to 1.0 millimeter range. So this is against the opposing teeth. I like to see reduction. So I'm not quite sure if this is reduced enough. We'll look at undercuts. Again, very slight, tenth or a hundredth of a millimeter. The margins look very smooth and the surface looks very smooth. This is something that you can skip after you've done this a few times. We're going to go next to design, and we're going to allow the restoration to calculate. Once the restoration calculates, the very first thing I want to do is check to make sure that it's not too thin in any areas. As you can see, I talked about, well, I thought this might be a little bit thin. And now, if you look, we have all this light blue. And if I shut off the contacts, you can see this all in the central fossa. This is where we always under-reduce. Now, there is a possibility I might be able to move this up. I could use a form tool and could go in with form and add. This works very quickly. I could also go to the move tool, and I could move this vertically and get it out of this underprepared state. I'll go back to form and just add a tiny bit there. So at this point, it's no longer underprepared, and we're not into hyperocclusion. We've got just a little bit of occlusion. We'll get rid of it. We want the solid blue. Remember, it takes that into account. Now, the other thing that you could do is if it is severely underprepared, or as you're trying to add, you put it into hyperocclusion and it turns red, and there's just no way you can add enough. You don't want to grind off the opposing teeth. So that's where you would go back to acquisition, and it's going to ask me, it's going to say that it's already formed the models. Do I really want to do this? And I'll just say yes. And you could unlock, go to your lower jaw. So I'll hit unlock, lower jaw, and then cut this area out where it's thin, re-prep that extra 0.5 millimeter that you need, and then rescan and start the design again. I was able to fix this without re-prepping, so I'm going to go back to the design mode, and we're slightly in hyperocclusion. And if I look at this restoration, there's really not much I'd want to change. And just to show, maybe I'd want to do, let's say, slightly in this area, I want to close that space. What I can do with that is I'm going to change the shape of the tooth, and I'm going to use circular 2-directional, and I'm going to come to this area and I'm just going to pull it. And I'll do it in a couple of steps. And I'm just pulling this over in the direction that the arrow goes, and as long as I've got it, I'll pull that area up. As you can see, I now have this widened the way I like it. If I look down the marginal ridge, I think the marginal ridge looks fine. If you were thinking, well, maybe this marginal ridge is a little bit high, as long as I've got the 2-directional tool on, I could go in and let's say maybe move this marginal ridge up. I wouldn't do this, but it's just a possibility. I just wanted you to see that you could use many different tools for this. I just raised that, and that didn't work too well. So then I'll go back to add, and I'll just give it a click and add a little bit. Now remember, and a little thin there, so I'll add slightly. The add tool works extremely well. The main thing I'm doing with this is make sure it's thick enough so it won't break. Now the very last thing that I want to do is check the interproximal contacts. The very last thing I do is check the interproximal contacts, but before I do that, I want to go to contacts on the side, and I'm going to click occlusal contacts. So I'm going to left click occlusal, and you can see it now ground this down. So it's in my perfect contact setting in the parameters. I'm also now going to go to trimmed model, click my trim model, and you can see that this is very, very large, this red. Red means it's penetrating more than 100 microns. Because that's so large, I would probably again go to circular two directional. I'd put this right in the middle and then just pull this back in. Now that may be just a little bit too light. So I would go back with the form tool and right click, set the size, and now just add a tiny bit until I got the context that I want. Normally, I like to have with my machine just a tiny bit of yellow. Some machines need only green. That's something you have to experiment with. Now this does not look quite as bad, and as long as I have the add tool, I'll just go to smooth and left click and hold and just smooth this down until it is the color that I want, which is just a little bit of yellow. Now at this point, I have checked my interproximal contacts. I've checked the occlusal contacts. I like the form. And I'm just looking right here, and now it's, for some reason, I guess I missed. So I just added a little tiny bit of porcelain there. And let's blow this up. I don't see any, well, there's a little spot. I'll add a spot there. And because I've changed the occlusion again, I'm going to go back just in case and hit the occlusal contact button. All right, so the machine has now finished. I like what I see. I'm going to untrim this. And once I'm happy with everything, I'm going to click Mill. It's going to calculate the milling preview, and it's going to tell me that it wants a Emax CAD size 14. I'm going to look at where the sprue is, and I'm happy with the sprue. I like it somewhere on the buckle. And then all I would do is click Start Mill.